Everyone, and welcome to the Board of Multnomah County Commissioners Board Briefing. I will like to say we have full attendance today, although Commissioner Stegman will be leaving at 11:30, or is excused at 11:30. Today's meeting is a hybrid board meeting. Some presenters and guests will appear in person, and some will appear virtually. For those presenting virtually, please mute your mic when not speaking. When presenting, make sure to unmute your mic and turn off your camera. For all presenters, please state your name for the record before speaking or responding to questions. Today's first briefing is on the Phase 1 of the Multnomah County Animal Services Review. On my first day in office, leadership at Multnomah County Animal Services, which was still closed to in-person adoptions due to the pandemic, informed me of the severe crisis we were experiencing due to a surge in intakes of stray dogs. To save animals' lives and begin a reset of the situation at the shelter, I directed that we pause intakes for 1 week and prepare to reopen the shelter to the public for the first time in nearly 3 years. Thanks to the hard work of MCS employees, volunteers, as well as help from other departments in the county, we were successful in reducing the number of animals in our care, adopting out more than 100 animals. The public stepped up with the support of volunteers, contributing more than 600 hours of service in the month of January. While we were able to manage that crisis, it was also very evident that things had been unacceptable at Animal Services for too long. Systemic work to address ongoing issues had not been done or had fallen away during the pandemic. Like the public, I was frustrated, angry, and wanted action. In February, I directed my staff and the Department of Community Service leadership to initiate a multi-phase review of Multnomah County Animal Services operations and practices, with a clear mandate to review past recommendations and focus on immediate actions that could be taken to improve the environment at our shelter for animals and staff. The first phase of the review, which we're being briefed on today, is an accounting of the status of those recommendations. It also included the development of a budget narrative and the beginning of a contemporary environmental scan of current shelter operations. The information you'll receive today is very difficult to hear, with more than 50 recommendations made by the auditor and subject matter experts not yet implemented. And even many best practices that saw progress in recent years have been significantly backsliding during the COVID-19 pandemic. As we begin today's briefing, I renew my commitment to closely monitor Animal Services through the remainder of this review process and throughout my tenure as chair. I will not allow the status quo that poorly serves animals, staff, or the community to continue. The actions and investments necessary to overhaul MCAS will happen. While I have trust in the leadership, including our newly appointed Director of the Department of Community Services, Margie Bradway, and the Director of Animal Services, Aaron Grayhick, I also expect to see daily action and improvement. With that, I will turn it over to Aaron to start our briefing. Good morning.
And good morning. I'm going to go ahead and start us off this morning.
Thank you.
And good morning, Chair Vega Peterson and Commissioners. I'm Lee Gerard, and I'm the Interim Director for the Department of Community Services, and I use she/her pronouns. And I'm here this morning with Aaron Grayhick, the Director for Multnomah County Animal Services, to share an update on the outcome of the first stage of the review of the Multnomah County Animal Shelter. As a high-level summary, the results of this first phase are very sobering. A significant number of recommendations have not been implemented. Many that did see progress between 2016 and 2019 during the pandemic. There was backsliding during the pandemic, and with the outcome being that only 10% of the recommendations have been completed. 60% are in progress or only partially completed, and a full 30% have seen no action. The process of conducting this initial review of all past recommendations is important because we knew that recommendations had been made, but they were not being tracked in one place, and we needed to have a clear understanding of the necessary work ahead of us. We are committed to making changes and improving the situation in real time, even as we continue this review process and work to develop a longer-term implementation plan. Next slide, please. This is just a quick review of who we are and what our focus is. So just a reminder that Animal Services is the primary agency serving found and at-risk animals from all the jurisdictions within the county, including cities and unincorporated areas, and that Animal Services is responsible for enforcing Oregon animal laws pertaining to cruelty, neglect, and minimum care standards. Next slide, please. So, starting with a little background in what happened. In January, as the chair has said, we approached county leadership with an unprecedented request to halt intake of healthy stray dogs for 1 week so that we could focus on reducing shelter census and prepare for opening the shelter to the public. We are grateful for that opportunity, which allowed us to prepare our organization for finally reopening our doors for in-person adoptions after being closed to the public for over 2 years, with only virtual adoptions available during that entire time. While this is a huge achievement, one of the many comments that we've received is, why did it take so long, and where are the improvements that we need to see? Next slide, please. So there are a number of compounding issues that Erin is going to be highlighting as she goes through the review with you. But really shortly after reopening our doors, there were a number of articles that began to come out about the Animal Services longstanding issues. Specifically, those issues brought to light were about the years of compounding problems with Animal Services that were detailed in multiple audits, consultations, and employee and volunteer interviews. By the time that Erin Grayheck arrived in early July, the director position for Animal Services had been vacant since February of 2022, with Erin being the 4th director in 3 years. The operations manager position, which is now filled by Marion Cannell at the end of October, had been vacant since March of 2022. And the division had also had a 17% vacancy rate and was experiencing high staff turnover. This brought the Animal Services into one of the most critical moments that it's experienced in recent history.
Next slide, please. Good morning, Chair Vega-Peterson and Commissioners. For the record, my name is Erin Grayheck. I use she and her for my pronouns, and I am the director at Multnomah County Animal Services. As a result of that first week in January, the chair committed to a deep and comprehensive review, which includes 4 phases. Phase 1A, and phase 1 is in 4 phases also, so there's a 4 pattern here. Phase 1A was completed by Ron Sarazin of Olympic Performance Incorporated, an independent contractor with institutional knowledge of Multnomah County's animal service operations and our history. Phase 1A focused on a detailed review of all previous audits, reports, and recommendations that have been conducted over the last 6 years, followed by a careful accounting of the recommendations made, a status update on each, and information about the choices made to respond and implement previous recommendations. The material includes the 2016 Animal Services audit from the county auditor, the 2018 follow-up audit, 2018 grant-funded consultation services from a national organization, Dogs Playing for Life, recommendations from a 2020 Animal Services Collaborative Working Group called the Transformative Journey Project, and recommendations from ongoing consultation with the University of Wisconsin Shelter Medicine Program. Next slide, please. As Lee stated, the findings in Phase 1A are sobering, as reflected by this slide, which shows the numbers that have been referenced already this morning, and include a tally of recommendations from the 2016 audit, the 2018 audit follow-up, the Dogs Playing for Life consultation, and they're sorted by status. It's important to note that many of the recommendations marked as partially complete or incomplete have seen progress towards implementation or may be in process, but with an alternative approach. Next slide, please. I'd like to take a moment to highlight major findings in 1A. Significant areas remain to be addressed, including staffing and volunteer levels to meet national cleaning, feeding, and enrichment recommendations. This is an area corroborated by all sources reviewed. Developing a positive organizational culture to build physical, emotional safety, trust, and belonging for our staff and volunteers and the pets in our care. Safety equipment procurement, training, and protocols. Data integrity checks for data that is entered in our data system, Shelter Buddy, and data that is reported out to the public. Behavior and euthanasia decisions and activity documentation. Comprehensive staff training and development and implementation of concrete policies and procedures, including specific work instruction. Coordinated enrichment activities and recording of these activities, facility improvements for security dogs, small animals, and our outdoor dog areas. Next slide, please. When Marion Cannell arrived at Multnomah County Animal Services at the end of October, beginning of November, I asked her to focus from the very beginning on 2 key areas: partnering with me on staff morale and retention of our outstanding employees, and using her deep and broad experience in animal welfare to engage in a total review of policies and procedures and operational norms at Multnomah County Animal Services. Next slide, please. Phase 1C, which is that environmental scan, includes a summary of shelter operations and operational or policy changes that were made or are recommended as a result of that review. This environmental scan process is ongoing and is not considered complete or resolved. A key focus of this work has been to identify what is needed and hone in on how to move forward from here. Understanding the problems facing Multnomah County Animal Services in the past and what is critical to work on in the immediate versus near and longer term future. Honestly, at this time, everything that we are working on is urgent. Lives depend on these updates and improvements. As we have engaged in this environmental scan, we have applied rapid process improvement strategies, adjusting our priorities in real time to meet community need and work to ensure the safety and well-being of our community and the pets in our care. An example of shifting priorities and making rapid process changes are changes that we made to our bite quarantine policy as recently as last week, following a dog attack that occurred to a community member. And we made an active decision to determine that all pets who commit that sort of attack that are at large will be quarantined in the shelter. Next slide, please. Phase 1C, we also talk about next steps here. As we engage in this review work, we are not just rewriting policies. We are rethinking the way that we do things and how past practice has informed that work. We are looking at how it impacts animals and our community. We're looking at how do we focus on the care and nurturing of the animal-human bond and the safety of our public and our community. Animal services must change as the animal welfare industry changes. Rethinking the way that we do things, how it impacts animals and the community, applying an equity lens to our work. This is similar to what the industry is doing nationally as I had the opportunity to learn when I attended Animal Expo at the beginning of April just this year, and spent time learning and networking with 2,500 animal welfare professionals from across the country. We must use research-based conclusions that help us rethink our approach. Sometimes what we've been doing or what historically instinctively felt like the right way may run counter to emergent industry best practices and findings. There are many passionate stakeholders in our community. We are grateful for them, and there are many varying opinions. We have to rely on data and industry experts. We have to acknowledge when there are opportunities to improve and change, staying aware of industry standards and evidence-based practices. As an organization, we must embrace change and use strong change management techniques to support our staff and community through times of change to make improvements in our shelter. We need to focus on the pets in our care and our community needs today and tomorrow. By the same token, there will be stakeholders in the community who also have feelings, opinions about changes that we must make, and we have to create opportunity for dialogue. Next slide, please. Phase 1B speaks to budget and staffing recommendations. It includes a summary of budgetary and staffing recommendations in response to direction from literally every external review, which stated that Animal Services was not sufficiently staffed. Multnomah County Animal Services leadership conducted a study of staffing with assistance from our regional partners, the Oregon Humane Society, consulting with their operations department on their staffing methodology. We also consulted with Dr. Sandra Newberry, who chaired the committee and served as primary author for the development of the National Association of Shelter Veterinarians Guidelines for Standards of Care in Animal Services. Dr. Newberry confirmed the basic assumption formulas recommended by National Animal Care and Control Association for calculating shelter staffing needs, with some variances for the needs of our shelter based on her consultation history and knowledge of our organization's operations. Dr. Newberry recommended additional time for cleaning and enrichment depending on species. Next slide, please. Dr. Newberry, again, affirmed that basic formula recommended by NACA, the National Animal Care and Control Association, for calculating staffing needs with some variances. She recommended additional time for cleaning and enrichment based on species, and this slide reflects those figures. So we look at essential functions of feeding, cleaning, and then add in enrichment. We've added in time for intake, adoptions, and other daily tasks. Next slide, please. In terms of budget recommendations, we have built our recommendations on the following daily population estimates. Our average daily population, or ADP, of dogs was assessed in the range of 80 to 90 dogs per day. Our forecast estimate for cats ranges from 69 to 134 animals per day, 5 to 15 small animals, and 0 to 3 other animals per day, which could include lizards, pigs, goats, chickens, ducks. Next slide, please. With average daily population assessments based on our current intake and capacity range, we have calculated the need for 15.6 to 25.9 FTE in animal care. At this time, we have 8 animal care staff currently assigned, 8 per day, assigned to these roles. We are requesting 6 additional animal care staff in the budget to meet minimum care standards for feeding, cleaning, enrichment, and to maintain shelter operations and services. We plan to supplement remaining FTE with volunteer hours which is a standard practice in animal sheltering. We've assessed our current volunteer hourly contribution to be an average of 2.5 to 4 FTE per day, and that's a calculation based on our volunteer efforts since the beginning of January. In addition, in our budget requests, we have requested 1 additional dispatcher to support field services calls and 2 additional office assistant senior staff members to provide client services supports for admissions, adoptions, and the need for customer support in all of these administrative areas. Next slide, please. And I'm going to turn it back to Lee Gerard.
Yes, so we still have quite a bit of work to do. So I'll be talking just a little bit about the next phases of that. So our next step is really to focus in on community and stakeholder engagement. Our intention is for this to start in May. We're in the process of finalizing the contract for this work. We will have we're planning a variety of engagement activities for the community so that they can connect in with us and our contractor. We'll include small groups and surveys for stakeholders and the public. We'll work with partner agencies, staff and volunteers, community members served by or interacting with animal services. This will be facilitated by a professional third party, and the goal is really to end up with a report that reports out on common themes and feedback. One of the goals, along with connecting in with our mainstream or regular stakeholders, is to also prioritize engagement with historically underinvolved or underrepresented populations in our community who are also owners of pets. So that'll be a key part of this phase. Next slide, please. So summarize the final stage of our the review process really includes summarizing the findings from phase 1 and 2. We'll be compiling a final report that summarizes the findings, and this will also include a robust implementation plan with recommendations, deliverables, and timelines. We are in the process of recruiting a limited duration project manager who will be walking alongside both the Multnomah County Animal Services staff and leadership, and also having the commitment of support from the Department of Community Services leadership group to really support this ongoing work over the next 2 years. We know that this is a commitment that needs some longer-term support for the activities. We're also committed to transparency, and we are posting and will continue to post all reports and documents related to this review, and actually on both the Department of Community Services website and the Animal Services website, and we will be posting future updates to that website as well so that people have access to that information in real time. In closing, I want to reiterate the commitment to making changes in real time and also ensuring lasting and sustainable changes within animal services, with the goal of ensuring the well-being of animals in our charge, the community, and our staff. That's the end of our presentation, and we are available for questions. Thank you.
Thank you, Erin, and thank you, Lee. So we'll open it up to the board for questions and comments, and we'll start with Commissioner Myron.
This is a tough one for me to comment on and to hear about. And I want to acknowledge, first of all, that there are some exceptional community advocates, members of our community, and organizations who have been reaching out and trying to scream at us to say these things have been happening for years. I see a couple, Barbara Spears, John Gramstead in the front here, and thank you for doing so much. And you know, as the chair mentioned, with the report, I was frustrated and angry and wanted action. And there have been issues that I've been raising for at least a year when the gravity of these issues came to my attention through, again, some incredible community-based organizations and partners, particularly, again, call out the Pixie Project, who I was just reviewing one of the emails that I had sent, and it did go to Jamie Waltz, who was our former head of the department, and to Aaron, who's here, and who acknowledged that our chief operating officer was aware, that Aaron was aware, that the chair was aware, and they were having meetings and looking at some of these issues at the time. And at the time, it's like, okay, who else would be taking action on some of these things? And come January, I hear back from Pixie Project, I hear back from some community partners. Nothing seems to have been done. And the way that the information about the degree of crisis, I did not know about the depth and breadth, but did know about some scary things and raised them. I asked our county attorney's office about some of them, and the county chair's office is aware, people are aware. We're handling this. And obviously this did not happen. And I have been just devastated and trying to figure out, even now when we talk, we use the words urgency and we use the words real time, and we're going to make progress improvements. But what does that mean? This happened in January, and we need to review, have some of these documents reviewed and come up with recommendations, and it's taken 4 months almost to do that and get those. And I understand that it takes some time to get the information and compile it and put it together, but to me, having even that amount of time does not seem like urgency. And the time, it seems like, the example given for when we, we're making rapid process improvement strategies, and the example was a week ago with the change made to the bite quarantine policy, and that was done in response to some reporting in the press. It seems like we respond to things that come out in the press, then we make some urgent changes. I'm curious if there was anything you can give as an example that was not reported in the press that we did proactively to respond to some of the recommendations that were brought forward.
I can, Commissioner. Thank you.
Thanks.
Another example of improvements that we have made in processes has been around changing the span of supervision with our animal care supervisory staff, so that they have a more equitable number between the two supervisors, so that they could provide more hands-on training to their staff. And so we are focusing those tasks. One of them supervises staff who does adoption and intake, and the others supervises the staff who do kennel care. And so we have been doing very focused training for our staff on adoption counseling work, and in terms of kennel care and cleaning and enrichment activities. That supervisor has been doing small group and one-on-one coaching and mentoring of the animal care staff. We have improved our opportunities for when staff are handling pets, that we're working on doing what we call pet meets or one-on-one. That's one of the things that adopters have been asking. People are adopting and they have other pets in their homes. So we are doing a much better job of gathering information about the pets in our care. And as recently as I think 3 weeks ago now, we have also slowly been resuming playgroup, which is a tremendous enrichment activity for the pets in our charge. It lets us are benefiting. Those dogs are benefiting from being in small groups. And again, it gives us information so that we can help adopters know as well as transfer partners to know. That's one example.
Thank you. No, that's a great example. And I think it is important to be elevating some of that proactive work that is happening because there are these things that we're doing that that maybe don't show up sometimes, and we need to be talking about all of it. And so I really appreciate that, and do want to acknowledge, again, going through those emails from last year with the department director who had mentioned that in response to my email raising these concerns from some partners, that sometimes there is just difference of opinion in how shelter operations should happen. And I hope that moving forward, that is not our response, that there are much more that we bring these things to the forefront, that we are taking action. I appreciate the plan that we have now, and that regardless of how it came to be, that current chair is taking action, and we are and that we are going to be making a difference in the lives of the animals that are in our care. So thank you.
Thanks, Commissioner.
Thank you. Commissioner Jayapal.
Thank you, Chair. Thank you, Erin and Lee, for this report, and to everybody for the work. Thank you, Chair, for initiating it. It is obviously incredibly concerning to learn of the years of recommendations that weren't followed up and implemented. And without kind of repeating or piling on to Commissioner Myron's comments, I think to add something new to the conversation, what I would say is that what it highlights for me is the need for more formalized process around elevating recommendations that are made. So I'll start with the audit process, right? So there was an audit report in 2016, there was an audit report in 2018. There is a formalized process for a response to the audit report, but what it appears there isn't is a formalized process for the board to be continually updated on the actions that are being taken on an audit. So that's one piece that occurs to me. Similarly, it appears that there were all of these other evaluations done, none of which were ever elevated to the board. And I'm looking forward to a conversation with the chair and the chair's office about how we ensure that those kinds of reports are elevated to the board as well as to the chair's office. Now, it can't be every report that's ever done in a county the size of Multnomah County, but I think we need to have some sort of standards for when evaluations and reports about essential county operations are created so that the board has visibility into that work and then has the ability to follow up. So those are some of the things I look forward to discussing. And another category I'd say is budget requests. It appears that there have been recommendations around increasing staffing for some time now. I am going to assume that those requests had been made at some level, but unless something ends up in the chair's budget that the board acts upon, there's no way for the board to have visibility into those requests. So I think that's another category, and there may be others as well, and I think we need to have a conversation about what communication and transparency to the full Board of Commissioners looks like on these issues. So thank you for the work. I am looking forward. I guess one other, you didn't talk about a timeline, and I know there's a timeline in the materials, but I think for public information, could you talk a little bit about what the timeline looks like for the next steps?
Yeah, absolutely. Thank you, Commissioner. As Lee mentioned, we are hoping to finalize the contract with the community nonprofit who will lead the community engagement work. I am meeting, we don't have a signed contract yet, and so that's why we're not sharing publicly the name of that group. I hope to have that soon, within the next week, and we are asking them to launch the online survey by mid-May, to be convening. We're going to be pulling lists for them of adopters over the last period of time, as well as all volunteers and staff. And then we're asking for a report from them by late July. And so then we will rapidly turn into, I also am intending to have that project manager hopefully hired by then. That's several months. It seems doable. And then the written report that will have the initial work plan and the initial metrics by the end of the summer.
Okay.
And then that will take implementation, obviously, in a thoughtful and thorough work plan will take a period of time.
Okay, thank you. And, I'll mention again a comment that I mentioned when we met about this last week or whenever it was. In terms of evaluating community feedback, as Commissioner Myron said, there has been a lot of feedback and a lot of recommendations, so I hope the process will include a review of what we've already received.
Yes.
In addition to going back out to community, we've received a lot, and I recognize it's a lot of pages, but there needs to be some way to look at those, digest those, and include them in the plan.
Agreed.
Okay. Thank you.
Thank you.
Thank you. Commissioner Rosenbaum.
Thank you, Madam Chair. First, I want to say how much I appreciate the work that has gone into this first phase of review. And I also want to express my appreciation for your candor and transparency. This presentation makes it clear that you're not shying away from an honest assessment of these issues over time and the true scope and breadth of issues that need to be remedied, which are considerable. I did have the opportunity to be briefed with my team last week on this report, and I had many of my questions answered already, but there are a couple of points that I'd like to revisit today. First, in the Phase 1 report, I note that there are several recommendations without a specific metric for success or completion. A couple of examples, the 2016 audit recommendation to conduct manual checks of animal records was assessed as partially complete in 2018. And then again in this current review, and to quote, it says, as reported in 2018, manual checks are completed, but there is no consistent process for who checks, when the check should be made, and what errors should be looked for. This is an example of a recommendation that will be difficult to mark as complete until a metric is agreed upon. And another example, there are sections referring to MCAS's work with the University of Wisconsin and their recommendations around employee satisfaction, safety, and healthy workplace culture, but I don't see clear targets for measurement. There are a lot of recommendations. How progress or completion will be measured is an outstanding question, and as many of these recommendations do not have an implicit metric for completion. So can you address when and how will we establish metrics for measuring progress?
Thank you, Commissioner. That actually speaks very clearly to why I asked our department leadership for permission to recruit the limited duration project manager. I really see a project manager with those true project management skills having the charge to work with me to review all of those recommendations, call out all of those gaps as you have identified them, and in all of the pages, it's likely that there are more, and that we very systematically identify metrics that are measurable, specific, and will hold us accountable. So I see that being reflected in the work plan by end of summer.
Thank you for that. And similarly, prioritizing among these many recommendations will be necessary. In your presentation, you expressed that everything is urgent, but a theme that I noticed throughout all of these materials is overwhelm. There's been lots of assessment, evaluation, and problem identification. I think we can't understate how challenging it is to parcel out and compartmentalize this work while weathering staff and leadership transitions, the pandemic, and other crises. A structured improvement plan is more likely to be sustainable through leadership transition, less likely to be derailed by turnover or crisis, or if it is paused or diverted, there is a clear plan to go back to resume work. That's why it's so critical to be planning for implementation as we conduct this work. Can you say more about how we are readying ourselves to implement as soon as practicable at the conclusion of phase 2?
Yes, and I think one of the first things that we are doing, and it speaks to the real-time piece, is the acknowledgement that we do have to create some time and space within our work environment to do direct care of the pets in our charge, and also to create that space for thinking, planning, and coordination and writing of policy, because it's really hard to do both at the same time. And so one of the things that we've already implemented as we're reviewing and writing and rewriting the policies and procedures is carving time out in Marion's schedule so that she has time, and I provide the leadership support at the shelter, and we're creating time for Marion to be able to telework and do that focused work to write and develop policies and procedures. And I think there is still work to do to create that framework that you described. Go ahead.
And I'd also like to add that the team, and Marion is really taking the lead on this, has already started some processes that will lead into the future process improvements where she is documenting, she's working with the whole team, but she is documenting all the organizational needs that include policies, procedures, training plans. She's setting them up in a way that's really transparent, that shows how we're prioritizing, and that's a real-time working document and showing progress. And we're also setting up some structures that will help staff have better access to centralized information, and will really be more systemic supports for the actions that need to happen.
Well, thank you for those answers. And finally, I just want to say I do appreciate, we all know this won't be easy and certainly very challenging work, but I do appreciate your leadership, and also especially, and I hope you can pass this along, appreciate and have a lot of gratitude for the very dedicated people that are showing up for work every day, that really care about the animals and want to do their best for them, and they need our support too. So I'm committed to that as well. Thank you.
Thank you. They're really outstanding.
Thank you, Commissioner. Commissioner Stegman.
Thank you, Chair. Thank you, Lee and Aaron. I'm sure that this is a very challenging board briefing today, and I just want to acknowledge that there were other people that were in positions of leadership. You stepped into a very difficult, challenging role. So the questions or criticisms that I may have don't reflect on you personally, but they do reflect I think how I would describe the state of animal service right now is disturbing. And it is very disturbing to this board, to myself, and I know to each of you, and for everyone who loves our animals in the community. I wanted to start out with, can you tell me what is the mission, what is the purpose of animal services? Is our priority dogs, cats, other? Because I think sometimes when I'm hearing from community partners, there's a disagreement about what our main mission is. So if we could start there, that would really be helpful.
Thanks, Commissioner. I think there are a couple of layers to our mission and purpose. If one reviews the Multnomah County Ordinance 13, which is the ordinance that governs our charge and actions, it speaks really clearly to a charge of taking in at-large pets, and it's specific to dogs. There is language in that ordinance that actually specifically exempts cats. And yet we continue to also see, navigate a place where we do provide care for cats. If a cat is in danger in our community or a danger in our community, that's a cat that we will take into our care to evaluate and engage in pathway planning for that pet. So a lot of the ordinance language does hone in specifically to dogs. There is also ordinance language around the public safety element that we are responsible for, and that's the animal control officers who have twofold responsibilities. They have responsibilities to ensure public safety as it relates to at-large or potentially harmful dogs or other pets, as well as a charge to investigate and work with law enforcement partners around cruelty, abuse, and neglect cases for the pets in our community. I think philosophically, we also have a fundamental charge to serve members of our community who are pet owners, to explore ways that we can successfully maintain the human-animal bond when it's a healthy bond for the pet and the human in its charge. I think that is work that we are committed to doing as well. It's less specific in the ordinance, but it's definitely reflected in our North Star and our philosophical intention of how we partner with our community.
Thank you, Erin. That's really helpful. So our charge is not cats, but we do take cats in. And so I know in talking to some of the community members that there is a perception so how we thought about contracting out, I mean, sometimes you can't be all things to everything, right? And if we are charged with dangerous dogs, as we've witnessed, continue to witness, and our resources are spread, has there been any talk about the line of business in which we find ourselves in?
I think we have had initial conversations as we look to exploring resource development and continued strong partnership within the animal welfare network here in our community. I think there's more work to be done. We do have partnership with some community nonprofits who serve multiple species and who serve cats specifically. And as we talk about prioritization of our work and we look at the immediate challenges facing us in the shelter and then continue to look at a time when we can be more and more deeply engaged in our community, those are exactly the kind of conversations and partnerships that I want to continue to explore. And I would say that we're not right there. We're not there quite yet.
Okay, well, I appreciate that openness to be, I mean, I think we have to go so far upstream and say, what is our mission? What are we immediately charged with? And while we've been doing all these other things, that's been great, but it's come at a cost, and we've lost our way. So I just really want us to be able to realign and focus on what we are responsible for. I know that we talked a little bit about the spay and neuter voucher. There have been complaints in the community about dogs being released. I know there's a veterinarian shortage, but I think it's important for you all to tell us about that program. Is it working? Is it not working? How does it work?
Thank you, Commissioner. That program started slowly. It was created last summer in response to a national veterinary shortage, as you referenced, and we have been actively looking to hire our second veterinarian position and have not been successful. And so we engaged in a pilot program, a kind of limited procurement process to explore capacity within community veterinarian providers. And we initially identified in that procurement process, I think we had 6 organizations express interest to move forward through the contracting process. First one, and then the second, and I'm not going to name them right now because I don't remember their names, and I can get that for you later. So initially we started with those 2 community vet clinics, and just one at first. They indicated that they had limited capacity to, like, they were concerned about like a whole rush of community members. And so we started sending vouchers out to adopters who had adopted pets with an expectation that these vouchers would be coming. The voucher is provided to adopters and can be used for the spay or neuter procedure and any related medical care. And so the agencies are authorized to provide that service. As I said, it was slow moving through the mechanics of the contracting process and then working to get vouchers out to every adopter from really about midsummer until December, as we deepened the bench, I guess I would say. We added the second provider and then continued to send vouchers out in March, I believe. We added a third provider, which is Oregon Humane Society, which has significant capacity to engage in doing the spay and neuter surgery. And so the methodology that we came up with Oregon Humane was that we created a Google document with all adopters who had not yet redeemed their vouchers, as we could tell through our reimbursement system. And so we sent a email out and contact out to all of those adopters, and Oregon Humane has also been working on contacting those adopters to get them scheduled. And now with pets who are adopted out, if we have not been able to do their spay and neuter surgery in-house, they receive a voucher real time. And so we have more capacity, and surgery vouchers are coming in at a higher level. So I would say the program is slowly becoming successful. And the next place that we're going in that program is actually Marion and I are meeting, it's either tomorrow with Oregon Humane to also engage in we included language in their contract to be able to do a pre-adoption spay and neuter program. So in essence, they will give us surgery slots every week for both dogs and cats, and we will identify pets, and we will use our volunteer transport folks to take pets over to Oregon Humane for spay and neuter, so that we're able to be far more proactive in terms of making sure that pets have had that surgery prior to adoption.
Well, that's great. I think it was important for people to hear, and because I had concerns, and when you and I talked, I was like, okay, there has been progress made, there is progress being made, and there is accountability to make sure that those animals are spayed and neutered. So I do appreciate that. Can you talk a little bit, other things that we've been criticized for is around euthanasia and the documentation, and I mean, I don't even know where to begin. If you could just talk a little bit about how that process is and how it's changed.
Yes, absolutely. One of the other changes that we have made, and this speaks to euthanasia, and it speaks really to pathway planning for the pets in our care overall, is that as we've hired and filled some of our staffing vacancies, we've been able to begin pathway planning for the pets who come into our care. Once a pet serves its stray hold period, that pet, if it's not reclaimed by its owner, that pet becomes the legal property of Animal Services. In the past, we were beginning pathway planning after that stray hold had been completed, which slows down the pet's stay, increasing the impact of fear, anxiety, and stress that pets experience in our shelter. So now we begin pathway planning sooner, acknowledging that some of the pets very hopefully will be redeemed by their owners, but if they're not, we're more ready for them to move to a transfer or adoption opportunity. And during that same pathway planning, we are working with our staff, and it's also slow and somewhat impacted when we have a higher volume of in-care, but we are working to assess pets sooner in their stay with us, and looking at both their medical conditions as well as behavioral status, which includes a risk of harm to an adopter. And so We use our rounds review to evaluate pathway planning for pets in our charge using those various criteria. Marion has recently looked at a documentation model where we have notes of round review every day where we're identifying what recommended interventions we want to try, including pathway planning, what's the pet's medical status. We have our program specialist staff participate in rounds review, and they rotate that documentation, and then we're using that documentation to actually be entered into the record so that we can reflect pathway planning and euthanasia decisions that are based on a pet's medical condition, which could include its behavioral health status, as well as pathway options and other factors that are used. We also are increasing opportunities. Our staff have had questions about that decision-making process. So we're also creating opportunities for staff to attend rounds so that they can have a better awareness of the decisions, the pathway planning decisions, including euthanasia for the pets in our care. And we are documenting that far more clearly.
Thank you. I appreciate that. I thought I had either heard or read something that we had taken kind of a hands-off approach, that if an animal came in and appeared healthy, that we were just not going to, have a veterinarian look at it. Is that not the case anymore?
The intake process is initially performed by animal care technician staff. And they bring the pet in and do an initial exam of the pet. They scan for chips and those sorts of things. And similar to any of us who are pet owners, if they see a pet's response, if they see the pet being inordinately stressed, or they identify concerns, the kind of concerns that we, as I said, as pet owners would call and make an appointment with our vet, then they put in real time in the record a request for the veterinarian and veterinarian staff to evaluate that pet. And then we continue to monitor the pet in care so that if things change for them, or for example, if pets come in and we see a high level of fear, anxiety, and stress, and we use a very low dose perhaps of medication to help the pet. We use trazodone because we see good impact, and it also isn't as distressful for the pet because the pet may not need that medication outside of the shelter environment. So we continue to monitor to explore the right dose and how enrichment activities and those things would impact the pet.
Okay, thank you. So going back to the recent animal attack, my understanding is that there was a policy where, maybe you can explain this to me, I just don't know how we could release a dog that has attacked someone. And I understand you've changed the policy since, and I'm grateful for that. But it does make me wonder, are there other policies that need to be reviewed so this type of thing doesn't happen in the future?
I would say absolutely, Commissioner. Every policy that exists at Animal Services needs to be reviewed. We have reviewed some of them, Marion, and that's the work that Marion has been combing through. And there are maybe hundreds, I don't know if there's hundreds. There are a significant number of policies that inform our work. And Marion has been working through them, and then as she reviews them, then pings me to review also, and we take to our management team so that we are actually reviewing every policy that had been written. We are reviewing policies from Marion's past practice as an animal welfare professional, where we are not able to identify policies that had been written at Animal Services, and she's bringing her expertise to then identify and write policies where we have not had policies before. So yes, Commissioner, absolutely there are policies that need to be reviewed and refined.
Thank you for that. I guess finally, I would ask if we could get more frequent briefings, as has been mentioned. I don't know what that timing is, but I would request that maybe it's even quarterly, If that's something that the chair would entertain, I would like to make that request. And then also, will there be another audit? I don't know if the auditor's office is, so there will be another audit. And when's that scheduled?
Actually, it is starting May 1st.
It's
It will
starting
be,
May
Yeah,
1st.
it'll be a review. The Auditor McGurk notified us, and they'll be starting May 1st, and we've already started interacting with her staff to give her access to the key information that her staff will need.
All right, well, very good. Well, thank you. Sorry to go into such detail, but this is what we're hearing from community members, and I thought it was important that we be able to respond. Again, thank you so much for stepping up into an incredibly difficult situation. I mean, we do need to hold you accountable because you're in charge. And we're the Board of County Commissioners, so I just want to make sure that it's very clear that we appreciate your commitment, and we need your commitment, and we need your follow-through and accountability. So thank you for being here.
Thank you, Commissioner.
Thank you. And Commissioner Ryan had a brief follow-up question.
Brief follow-up question. I really appreciate so much the questions and comments of my fellow commissioners. They were so thoughtful, and I wanted to just quickly go back to Commissioner Stegman's question about the overarching mission. And, you know, as we are sort of in triage mode of addressing the immediate crises, also taking that step back to say, how do we prevent future crises? And our mission and the ordinance sort of putting that into code was made at a different time, a different place, a different sort of situation. And looking toward the future, you know, I think we maybe need to go back and look at what that mission is. Are there things that should be adopted, revise those ordinances so that we can meet the current needs and move into the future? Because for example, not accepting cats, you know, as part of that original ordinance, and not having a program to spay and neuter cats who are out there. To me, that seems like it would result potentially in a whole feral cat thing that will be much harder to deal with in the future if we don't get control of it now. So just wanted to put that out there to consider how we might look at the mission and change those ordinances. And
We have actually had initial conversations with our county council, and we'll be exploring ordinance review and coming before the board in the near future, nearish
thank you.
future.
Well, thank you, Lee, and thank you, Aaron. I will say part of the look is, I think, not just on our policies and procedures, that we have, the ordinance language, even state law that is impacting the way that we are able to do this work and what we need in order to support that work going forward. So it's going to be very comprehensive. In terms of the updates to the board, it was very important to me that we had the update as phase one happens. It's my intention to have updates as each of the phases of this review go forward for the board, so that we know what progress is happening and where we are and what we're learning. I've also asked staff to put together a list of all of the improvements that have been implemented since this work has started, so we'll share that. And then I'm open to having regular updates on animal services once this review has been done, so that we are staying on top of things, and appreciate the work of the auditor's office in looking, starting an audit, looking at the recommendations that and how they've been implemented for the past 2 audits as well. I also just want to say a very sincere thank you to our volunteers, our staff, for the work that they've done, but also for the way that they have been lifting up these issues and bringing them forward. I want to thank the members of community who have been doing the same thing, and really want to appreciate the other leaders in our local animal welfare community for their engagement in this issue. They've reached out, they've offered advice, insight, and partnership as we're going through that. That is things that we have been taking them up on. I want to specifically thank Commissioner Rosenbaum for your work that you've done in doing that, especially with your role on the Oregon Humane Society Board and helping make those connections. Phase 2, the expectations there is that this is going to be really about the outreach and the engagement of our community, of our partners, of our staff, of our volunteers, and it is inclusive of folks who have reached out before, and I know that we have tracked that, and so that they will be a part of that. And then, and then really the phase 3 piece, right, is the very specific plan, but it's not a beginning point of that work. This is work that is currently happening, will be ongoing through this process, and then definitely will have, the kind of organization and timeline, metrics, all of those things that will be a part of that phase 3 work. So a lot of work in front of us, but we'll continue to move this forward with urgency, with transparency, and with the commitment to see this through. So I appreciate you both being here today and for this, and I know we will be having you back here. So thank you.
Thank you.
So our next board item will be a discussion and a chance to hear from our managers of color. So I invite folks to come down here. This is really an opportunity for our managers of color, ERG leaders and members to come before this board and share their experiences at Multnomah County. This discussion came out of a meeting I had with MOC leaders on December 9th of 2022 as I was getting ready to come on board as county chair. As a commissioner on this board for 7 years, I had heard the challenges and frustration of our employees of color at Multnomah County and the specific and unique challenges faced by our MOC. Implementing Multnomah County's workplace equity strategic plan and making our organization a place where employees truly feel safety, trust, belonging, and respect is one of my top priorities of chair, and so I prioritized that meeting with MOC early on. Having this discussion today is a chance for this board to hear and the public to have transparency into the experiences and challenges we face, but also the commitment we have to make progress on what managers of color experience, what all our employees experience at Multnomah County. So I appreciate you being here, Dr. Richard, and invite you to begin.
Thank you so much, Chair, and to Commissioner Myron, Commissioner Jayapal, Commissioner Rosenbaum. It's a pleasure to be back in this boardroom, Multnomah County boardroom, the boardroom of the people. And it is a pleasure to be able to sit before you all once again. Commissioner Stegman, thank you. We know you have to leave early, but thank you for the time that you're here, and we will connect with you at a later date. And again, we're just grateful to be here. Elena Wilson is here with me from the Sheriff's Office. Tamora Barnes, our co-chair, was not able to be with us in person. She might be online. Teresa Kelly, another MOC executive member, was not able to be with us due to a death in the family. And Mr. Tony Gaines, MOC executive board member, is not able to be with us. He had a doctor's appointment that was of the utmost importance that he had to attend. But I want to recognize the contingency of managers of color who have joined in this boardroom today in support of some of the information, some of the comments, some of the statements and testimonies that you will be hearing today. We appreciate individuals for taking the time out to come and support and be a part of this discussion, of this conversation, and this dialogue. Chair, as I said to you before, there is no element of surprise today. You have my word, you have my guarantee on behalf of the MOC executive team. There is no element of surprise. There's not going to be a gotcha today. It's just going to be people sharing their raw emotions, people sharing information that is extremely and immensely important to them about the state of affairs and about the plight of managers of color in Multnomah County. In my opening statements, what I will say, I came to the county in 2014 after approximately 23 years serving in the state of Oregon at the Department of Human Services. Appreciated my transition from the state to Multnomah County. I'm a lifelong Multnomah County resident. What I come to understand about being an employee and manager of color in Multnomah County, I quickly learned that there are two Multnomah counties. There is a Multnomah County that exists where certain employees who represent a certain ethnic group experience everything that the county offers with respect to safety, trust, belonging, acceptance. We have an ethnic group of individuals who experience that. They come to work every day. They're very comfortable being their authentic self. They have no fears. They have no worries. They go about their day to day. They get the support they need. They get the protections that they need. But then there's another Multnomah County where managers of color do not experience safety. We do not experience a high level of trust. We do not experience the comfort of belonging. There is a Multnomah County where individuals of a certain ethnic group do not experience racism. They do not experience systemic oppression. They do not experience discrimination. But then there's another Multnomah County where managers of color are expected and called upon, as I said in October, to manage, to lead, to facilitate, leading with race. And we do that every single day to the best of our abilities. When we wake up in the morning and roll out of bed, we come to Multnomah County. And with everything that is within us, we want to do what is right in leading with race, while at the same time leading with race, we experience racism. We experience oppression. We experience discrimination. We experience fear. In this other Multnomah County, we can never show up as our authentic selves. Our culture is not appreciated. Our ethnicity is not appreciated. Yet we hear individuals tell us that diversity is imperative. Yet we hear individuals say to us that we need diversity in order to meet the diverse needs of the community. I believe that. I believe we should have a workforce, represented staff and management staff, that reflects the demographic of the community we serve. The question before us today: how can we serve if we receive little to no support? Chair Vega Peterson, I am firmly confident that you understand the need for diversity, equity, and inclusion, safety, trust, and belonging. I firmly believe that that is a priority for you. I believe that's a priority for Mrs. Joy Fowler, who directs our diversity and equity efforts within this county. I believe for Serena Cruz, it's a priority. Travis Brown, it's a priority. The problem that I do not believe gets much attention is what happens with the expectation that comes from the chair's office, that comes from the COO's office, that comes from the Office of Diversity and Equity, the expectations that come from Central Human Resources, in Multnomah County. The issue I see is not with that level of leadership. It is with the leadership that is directly under the COO, that permeates down to some department directors, not all, that permeates into some deputy directors, some, not all. And then when we get to division directors, senior managers, what we're finding out is that the expectation in most cases is not being followed. What we're seeing is that a wall of fear has been created. Again, I appreciate the contingency of managers of colors who are here today. One of the things we found out in closing, and I will turn it over to Elena Wilson, and she has some testimonies that she will read, and there will be others, Madam Chair and commissioners, that you will hear from today. Many managers of color contacted members of the MOC Executive Committee and said they would love to be here, but they were afraid to come. I sat back at my home in my office. I even had to ask my wife this question: what would make somebody who works for Multnomah County, the place where some say is the regional leader for DEI, afraid to show up at a board meeting as such in support and solidarity? Chair, they were afraid. They were afraid of retaliation. They were afraid. They were afraid that if they came and attended this conversation today, that when they returned back to work, things would all of a sudden appear out of the air, and they're called into frivolous meetings by their leaders. It is very difficult when you know you need a paycheck to feed your family. It's very arduous knowing that you need a paycheck to pay your bills. But yet, there are some things you cannot do because you're afraid. Chair Vega-Peterson and commissioners, we have to deal with this notion that there are two Multnomah counties. People are afraid to escalate issues up because there's so much trepidation of how they will be treated in the atmosphere, in the organization, and the environment. Some people don't know what it feels like to raise or elevate your voice to address an issue and then come back and all of a sudden you're being called into a meeting and now your work performance is being questioned when previously your work performance was never questioned, because the person who leads you thinks that there's not a problem and they think you're raising an issue that does not exist. That is a very real thing that happens. These types of issues, Chair Vega-Peterson and commissioners, do not arise to your level every single day. This is why I thank you, Chair, and I thank you, commissioners, because back in October, when Mrs. Tamora Barnes and I came to present, we asked, could we come and have some time? And although that request was made under a different administration, we thank you, Chair Vega-Peterson, that you honored that request for us today. I want there to be one Multnomah County, in closing, where everybody, irregardless of your ethnicity, your culture, your race, your gender, your sexual orientation, I want there to be one Multnomah County where everybody experiences safety, trust, and belonging. And it is not just a notion or a concept that we talk about, but that there is real-time experience. I'm afraid sometimes to speak like this because of what others might think of me. I've been called a troublemaker. I've been called several nicknames that I don't like. People have said to me that I raise issues that really don't exist. People say to me, why don't you look and see that the glass is half full instead of the glass half empty? Well, the only thing I see is that I don't have a full glass in front of me. Yet, I'm called to lead. My saving grace in this county, and the reason why I came back, is because I had the opportunity to work for a very, very great leader in Mohammed Bader. I can assure you, Chair Vega-Peterson, that if that position would not have opened up in DCHS as the equity manager, I would have never come back to the county. The only reason why I came back is to jump at an opportunity to work for Mr. Mohammed Bader. Other than that, I would be somewhere else, because based on my past experience, it was not a good one. But I'm grateful to be in this position today. Thank you for listening. I yield to Elena Wilson.
Thank you. Good morning. I just ask that as I share these testimonies, that everyone keeps in mind that many of these stories come from managers of color that are expected to navigate and problem solve in their roles while continuing to experience harm. Manager A has elected to share anonymously in fear of retaliation. I have had my work unfairly scrutinized by white employees, including people being accused of showing favoritism to other people of color and LGBTQ employees. I have had the HR complaint process weaponized against me by white employees with repeated false allegations of favoritism and misuse of county time. HR was not supportive in my efforts to hold white employees accountable or manage the toxicity they created for queer and trans people of color, team members, myself included. Even after all allegations were found to be false, HR leadership was not held accountable and no repair process was offered. Manager B has elected to share anonymously in fear of retaliation. I am a female person of color. When I was first promoted as supervisor, my manager, who was white, would often during division management meetings disregard my contributions and suggestions while giving credit to another supervisor for the same idea presented within the same meeting or from a previous meeting. This same manager, during a one-on-one supervision, told me that the reason she thinks she and I don't communicate as well, or it takes me longer to get what she is presenting during meetings, is because you think in Spanish, which is not the case. The supervisor also told me I should not speak to my bilingual staff in Spanish, as it would be offensive to others who don't understand. The next testimony comes from Jacob Messman in DCHS. As a white manager who has been at the county for many years, I have seen and continue to see systemic racism within Multnomah County and the pain that it causes my colleagues of color, both represented employees and non-represented managers and supervisors. True inclusion in our organization to me means leading with people, listening, learning, and power sharing. Across the county, I have seen my colleagues of color not listened to, passed over for promotions, held to a higher scrutiny, and put in situations where they felt disrespected, and in some instances, ultimately pushed out of the organization. Not only is this heartbreaking and upsetting to me to see the impact of racism on my colleagues, but I see the tremendous loss that it has been for the county to lose great thinkers and people who truly have innovative ideas about making Multnomah County a great place to work. Manager D has elected to share anonymously in fear of retaliation. In my experience, being a manager of color means that it is more difficult to obtain the professional respect of colleagues, including staff, peers, and managers. I have to work harder, often with less, and with less help. The leadership traits to build and motivate a team under these circumstances is taken for granted. My judgment is more often questioned despite a track record of success and long tenure. White managers are often accorded much of this respect right away, whereas I have to earn it as if the promotion itself and long list of accomplishments weren't enough. I have often come up with novel solutions to problems that produce real-world results that improve operations. However, my solutions are often discounted by peers, and my advice goes unheard. Sometimes, great expense is taken for my ideas to be replicated by white colleagues rather than give me an opportunity to be a part of the solution. As a person of color in my career, it has long been a fact that it will be more difficult to receive recognition for achievements that are more readily handed out to others. These circumstances make it more difficult for people of color to advance in an organization and build the base of peer respect that is necessary to exhibit leadership. This next testimony comes from Chris Austin with the Multnomah County Sheriff's Office. As a white male manager, when I provide direction to and ask questions of my staff members, I have generally experienced professional behavior and prompt compliance. However, I have received reports and on occasion witnessed where a black female manager counterpart of mine has given directions or asked questions that have been dismissed, questioned, or simply ignored. This inequitable behavior is unacceptable and cannot change until everyone has the courage to speak up and call it out. A true leader should never walk past an observed inequity, but rather work to address and correct them on the spot whenever possible. When we think about the standards we want others to emulate, the most important consideration is what we accept and tolerate. Leaders who refuse to ignore these issues raise the standards for everyone. Great leaders have high standards, and one of those standards is to insist that others have them as well. The last testimony that I'm going to share with you comes from Kalisha Stout, Equity Manager of the Department of Community Justice. She states, "I'll keep my statement brief as I believe this message is too important to dilute. We are burning out. We have been asked to lift the voices of all staff, represented and not, to hear their pain, frustration, and righteous indignation, yet we are powerless in our efforts to center these voices. Too often we are gaslit, marginalized, and told to stay in our lane. We have the institutional knowledge to create meaningful organizational change, but we are leaving one by one. Therefore, I ask this to you as leaders who are accountable to this mission, but do not drive the work. How are we to make any sustainable change if our tenure is truncated?" Sure. Thank you. I'm going to ask at this time if Kelly Trolley would like to come up.
I was not expecting this. Thanks, Elena and Dr. Richards. I would say that as a white, cisgendered, leader, former leader in Multnomah County, I since left the county a few months ago. And I have to say, in my new organization, I was immediately appreciated for understanding organizational development work. My team tries to do organizational development work here. A team of people of color doing great work related to equity and inclusion. And what they see across the county, what I saw across the county in supporting our managers of color, is all the things that you heard today. The one thing I would also say is that it starts from the top. I agree with many things that Dr. Richards said, but I have to add that it starts at the top. And so I can think in my mind within the last few months of at least 3 managers of color who voiced up their concerns, who wanted a conversation, who wanted to be believed, and instead got either a no answer and left the county, got a lot of runaround of we need to do an investigation, we need to do these other things, we have to do these HR things, never got support, never got a conversation. As Kalisha said in her statement, got gaslit. There's so much gaslighting of our managers of color who just want an honest conversation about what is happening. And I see fear and defensiveness and lack of humility in our highest of leaders on down the line, that doesn't mean that they are bad human beings. We have great human beings who are afraid to have honest conversations around what racial inequity looks like in our organizations. We have all the right things written. We do. We have some great processes in place. We also escape to some of these processes around investigation and other things to escape having a real conversation and listening to the people who are impacted the most. So we continue to lose people, right? I know that their voices are heard at times, but then dismissed, shut down, and nothing done with the information. You had an exit interview process report that was shared. So much data that comes to you at this level is watered down, is given a positive kind of look, but what you're here today to hear is that what it really feels like on the front lines. And there's a lot of good work happening for folks, but there is a lot that just doesn't get traction, and people are gaslit, dismissed, devalued, and leave. And we're losing them all the time, every day. So thank you for hearing my voice. It's only important to me to amplify what's already being said. So thank you for inviting me to the table.
Thank you so much. Appreciate it.
Thank you, Kelly. At this time, I want to give Rebecca Sanchez a few moments to share as well.
Thank you. Good morning. Good morning, Chair. Good morning, Commissioners. My name is Rebecca Sanchez. I use she, her, pronouns. And I was previously the Equity Inclusion Director for the Sheriff's Office. Excuse me. Whew. It truly is an honor to be able to be in front of you and to speak and to be next to my colleague, Elena Wilson, here, and to have heard a letter written by my former colleague, Chris Austin. To hear him stand up and speak up honestly of what he has observed in his position of privilege, it means a great deal to me. And it means a great deal to the almost 3 years of work that I was able to do at the Sheriff's Office, which I am very proud of. I didn't want to speak today, but I had to, seeing who did speak up, seeing who is around here. It is my duty to speak up as well. I have given exit interviews, very open and honest exit interviews that are part of public record, and one done inside the Sheriff's Office and one done through Joy Fowler in the Office of Diversity and Equity. I encourage you all to request them and read them. I am also open to sharing more individually with you if you're interested. I do want to uplift what my colleague Kalisha Stout said in her statement, and I want to thank her so much. She is absolutely right that there are incredible people here ready to do the work, incredibly experienced, skilled, compassionate, strong, empathetic people, but they need to be able to do the work. They need to be able to have their voices heard and trusted. And we need to have the courage. We need to have the courage to understand that when we hold people accountable to disrespectful, inappropriate, harmful behaviors, that truly is the benefit of everyone involved, including the one doing the harm. We have to stop shying away from telling people what they're doing is wrong, because it truly is going to help improve all of us. I had a very challenging 3 years, a very challenging and a very beautiful experience. This work of driving and advocating for greater inclusion, a greater sense of belonging, so that we can actually see the diversity thrive here in our organization. That work, it will always be challenging and hard, but it should never be adversarial. I should not feel like I'm coming to work, going into war every day. I shouldn't have to experience nightmares and physical manifestations of the toxic stress. And I know that that is seen through my colleagues. I've seen colleagues talk to me about losing their hair, losing weight, gaining weight, different manifestations of toxic stress. That should not be how we need to exist to make that paycheck. Before coming to the county, I spent 15 years in nonprofits. It was a dream to come to the county, to be able to fight for community, be able to fight as public servants. And I thought, my goodness, I can finally do this job and make better pay in nonprofits. But money could only satisfy you enough through the work. And I want to say thank you to everybody who was there in support, but there's not enough standing up against poor, disrespectful, and inappropriate behavior. And I hope that is changing. This meeting, I think, is a testament to, I think, that change. And I just want to say thank you to everybody who wrote statements, everyone in this room, for giving me the courage to speak up. And I will be rooting for you, and I will always remain here as a community member and in all my other professional spheres. I will always be here to support Multnomah County and the community. And I want to thank you all so much. And again, feel free to look at my exit interviews. I did leave, unfortunately, without another job. And I think that that tells a tale to the experience. So thank you.
Thank you.
Chair, we thank you. Commissioners, we thank you for your time, and we thank you for listening to us today. There were a lot more stories, statements, and comments that we could have shared. We did not want to overwhelm, and we did not want to be redundant with sharing some of the same stories. I have a 6-year-old niece, Alexa Richard. My mother has 11 grandchildren, and they're all boys. Alexa is the only girl. And even at my age now, I get so jealous of my niece because she gets way more from my own mother than I ever got. I was at my mom's house and finishing up some work, and I said to Alexa, Uncle's gonna go get you some pizza. She loves those personal pan pepperoni pizzas from Pizza Hut. A lot of peas there. And I said, when Uncle is done, I'm gonna go get you a pizza. We're gonna go get a pizza. She says, yay. She went and told my mother, her grandmother, Uncle's gonna get me pizza, Grandma. You don't have to make me any cream of wheat. So I said, it'll be just a minute. I was caught up in a task, and she comes back to me about 5 to 7 minutes later and said, Uncle, I thought you said we were gonna get pizza. I said, I am. Uncle's gonna get you pizza. I promise. You promise? I said, I promise. I'm gonna get you pizza. 20 minutes later, I'm finally getting ready to go get her pizza. But she kept waiting. She kept saying, Uncle, when are you going to get me pizza? Grandma, Uncle said he was going to get me pizza. Uncle needs a whooping, Grandma. He's not telling the truth. I find myself sitting here today like my niece. When? I hear what's being said. I've heard it since 2014. And I'm not addressing individuals, I'm addressing a system. People go in and out of this system of leadership. Whether people choose to leave or whether they're termed out. People go in and out of the system of leadership. So far be it from MOC to blame anybody. But while we have individuals who occupy the seats, when are we going to change the system? Most of you don't feel, again, what we feel when we go to work every day. But I can echo the disrespect. I got 4 academic degrees, and I very rarely talk about my education. But I got 4. Bachelor, 2 bachelors, and a doctorate. I still find myself fighting for respect. As opposed to my white counterparts, when they stand up, they immediately grab respect. So again, the question is when will we get our personal pepperoni pizza? When? We yield back.
Thank you so much, Dr. Richard. We'll go to the board for any questions and comments, and I will start with Commissioner Jayapal.
Sure. Thank you, Dr. Richard. Thank you, Lena. Kelly, Rebecca, everybody who submitted testimony, all of you who are here to support the testimony. It's such an important conversation. Thank you for following up and making sure that this happened. It's hard to hear, but I know it's even harder to experience, so I'm not elevating the hard to hear part. I'm not shocked. You know, I think that Multnomah County reflects the world outside, and we are better in some respects, and we are not good enough in many, many respects. I'm also not shocked because, Dr. Richard, to your point, while I have a lot of privilege by being in this position, there was a phrase that really stood out to me, and I don't know, gaslit, marginalized, and told to stay in our lanes. I do experience that. While not to the degree that the folks who've testified have shared their experiences. You know, I think while we reflect the world outside, we expect a lot more. And I am a bit of a linear thinker, I will confess to this, and so I go really quickly to trying to think about solutions. But I think it's important, frankly, I think it's important that we do this on a regular basis and that we hear people's experiences to the extent that they are able and willing to share, because I know we ask a lot when we ask people to share their experiences. But I think it's important to do it because it's a reminder that time is passing. To your point about the, you know, when do we get the pepperoni pizza, and I did love the story. It can be really easy for time to pass and progress not to be made, and therefore the systemic change not to happen. So having said that, I go to solutions. I am, you know, I am thinking, and I want to hear what those systemic solutions look like. So there's a piece of this work that's about changing hearts and minds, and there's a piece of this work that's about changing the system. And I feel that what I can be helpful with is changing the system. So I wasn't here for the West presentation. I was visiting my parents in India. But I think that where I am committed is to hearing some of those ideas and solutions and advocating to bring them forward. I do believe that in this board, you have a board that is committed to working on that change, and you have to hold us accountable just as you hold everybody else accountable, and I think that's what you're doing, and I appreciate it. So there's a lot more to think about and follow up on. Rebecca, I'll say that I didn't realize that you had left the county, and I will follow up on your invitation. Thank you for making it. I'm really sorry to hear that you've left. My door, I've said this before, I'll keep saying it, my door is always open. And it's not just my door in this building. If folks are more comfortable going outside the building to have a conversation, I am very open to that as well. So I hope anyone who's listening will take me up on that. And, you know, you have my commitment to continue to follow up and to advocate. Thank you.
Madam Chair, if I may answer the question about solutions, there's one easy answer to solutions, and it's accountability. That's the answer. If somebody violates intentionally or unintentionally a county policy where the intent of that policy is to promote diversity, equity, inclusion, safety, trust, and belonging, the accountability has to be there. And not just a simple slap on the hand. And that, Commissioner John Paul, at least in the estimation of MOC, has been the issue. We as managers of color, if we violate a county policy, the perception is the boom is lowered on us. And this is why, as managers of color, we feel that we are the last hired and the first fired. That there is an inequity with respect to how discipline or potential discipline or coaching and mentoring is administered versus our white counterparts. It is not fun showing up not being in the good graces of your leader, and I'm talking about managers of color. Whereas our white counterparts don't experience that. So I think the foundation to any solution is there has to be accountability no matter what position the individual serves in. When we see managers of color, and the Employment Trends Report even confirmed that a lot of black managers are leaving. One left after 15 years. That's halfway to retirement. So again, I think the conversation that we would like to have and engage in, at least one portion of that conversation, is accountability. Thank you so much. I yield back.
And if I could just, I 100% agree with you, Dr. Richard. And, you know, one of the things that I thought, and that is something, thank you for that very concrete example, because that feels like something that we can follow up on. We can look at what has happened in the instances where complaints have been made, and we can see what the accountability response has been. I also find myself thinking about things like, 360 reviews. I mean, there are concrete things that we can do that relate to accountability. So I appreciate your bringing that up. Thank you.
Thank you. Commissioner Rosenbaum.
Thank you, Madam Chair. Thank you all for being here today, and for those who spoke and those who didn't speak and those who are just here in the room. It takes a lot of courage to do this, and it's very hard to hear, and it is distressing, but perhaps to me almost the most, the whole situation seems unacceptable, but it is perhaps most disturbing, the number of people who don't feel even safe talking at all or feel a need to be anonymous and fear retaliation. We have to address that, and people should never have to feel that way, but I understand it. And sometimes I think, people in middle management are the most vulnerable people of all, and managers of color clearly are experiencing that in ways that just can't be allowed to continue. So I think it's on us, on all of us, but particularly those of us who have this privilege and don't come to work every day feeling fearful, to make sure that we work on those solutions. I haven't been here long, and I won't be here very long, but as a community member, I commit to be open to making change, and all of us, I think, can do that. Hopefully we will. But thank you.
Thank you. Commissioner Martin.
Thank you, truly beyond words, for this presentation here today. To those who offered testimony, both anonymous and Jason, or Jacob. For those who spoke, Kelly and Rebecca, I too will be following up on the exit interview and just appreciate your telling your stories and that invitation and all that you have done. And I did not realize you had left either. I'm ashamed to say. And you have been so powerful and such an amazing voice. And Kelly, just getting that email, I remember email and hearing about your experiences and being so brave and speaking up and saying, you know what, I don't even have a job to go to, but I have to leave because of the culture here and because of what is happening and what I see and the injustice and unfairness from an organization purporting to be the as just, fair, equitable, etc., as we can be. I wrote down so many of your beautiful, powerful, and courageous words from all of the testimony and from both written, spoken, read here today, and synthesizing it. Words just came glaring out that I heard from the first time, Dr. Richard, that you and your team came to talk to me and share what you were experiencing. And they're paraphrasing some, but it's lip service, it's talk the talk, it's fear, toxicity, disrespect, gaslit. I want to say it struck me when you first came to talk to me about your experiences, and I was like, okay, what can we do? What can we do as the commissioners in this organization to change those experiences, to change culture? And sort of watched as those sort of floated along, and leadership at the highest of levels at the county did not follow through on what you were asking. In October, you came before us so powerful. You asked for the opportunity to do what you're doing here today. And it speaks volumes that it did not happen last year. And I just want to express my gratitude to Commissioner Chair Vega Peterson, for following through, for actually elevating, for setting the time, the space for us to be able to do this here today, because it is so important and it matters. And that itself is change, I say, at the highest level. You mentioned, Dr. Richard, you're not addressing individuals. You're addressing a system, but individuals lead the system. And when you said most of you don't feel what we feel when we go to work every day, and not remotely to the extent or in the same way, but as Commissioner Jayapal alluded to, the phrase feeling gaslit, marginalized, told to stay in our lanes. I felt it also. And I experienced toxicity related to that and stress related to that. And if we're feeling things like that as commissioners, where we have the power, where we have the privilege, where we have the paycheck, that we don't even have to, we don't have to think about whether we're getting that or not. I just can't even imagine what it feels like from the perspective of facing that every single day, coming to work, going home with that fear. And I just know it feels infinitely worse. And I can confirm that culture, the gaslit, all of that, it has permeated this institution. But I believe, again, the fact that we are having this forum here today, that we are following through, that this is an opportunity for rebuilding our culture and for walking the walk. And we have to. And I truly believe we will with this board and with this leadership. And so I'm so grateful to all of you for your courage in coming forward, for your powerful words, for speaking up and speaking out. And I know that I am here for you to do what I can in this role, and I look forward to our future together and to support you. Thank you.
If I may, Chair. Commissioner Myron, thank you so much. Going back to solutions, right? Let me highlight, if I may, one example. I want to acknowledge Travis Brown, and not just the work, but the impact, at least in my estimation, that he has had in his brief tenure here at Multnomah County. Prior to Travis arriving, MOC attempted to meet with some individuals to have a conversation about some experiences with managers of color who overwhelmingly inform the MOC executive team about having CIU complaints filed against them just for doing their job and doing the right thing, when an individual may not have been happy with their decision. There was so much difficulty trying to bring various stakeholders together to even have the conversation. And it doesn't feel good when you're attempting to have a dialogue about a very serious issue that's not only impacting someone's employment, but it's impacting their mental health. It's attacking their physical health, and people are hanging on by a thread. The MOC executive team did not understand why it was taking so long to get meetings scheduled, to have these discussions that were so important, that involved these stakeholders. Travis Brown was announced that he was hired. And within a month of meeting with Travis Brown, working together, we restructured these meetings we were having. And now MOC does feel that some progress is being made. The question that we come back to, is it about a solution or is it about time? It shouldn't take that long for individuals sitting together who understand what the issues are to make change. It's problematic when you're told you can't do this or we can't do that, when individuals have the delegated authority to make things happen. Now, if Travis Brown can come in and help make some of these changes in the short tenure that he's been there, I know other individuals who have been here in these positions could have made the same progress. And so while individuals have us waiting, saying they're going to get back to us, we're still suffering. We're still being attacked. We're still being asked to lead. A lot of individuals don't understand how uncomfortable it feels when you are adamant that you did the right thing, but yet a complaint that's filed against you, and you got to sit anywhere from 3 to 6 months while an investigation is going on, but you still got to lead. In some respects, you still got to work with individuals who file complaints against you. This comment has nothing to do, and it is not criticism of the CIU complaint process. I think that process is very much needed. I'm talking about the individual experience. And so this is why we come today to ask. We need not just the ability to elevate, we need the ability to escalate things. We need the ability to put things on the fast track when they're able to be put on the fast track and come up with a solution. Most of us would never ask or request anything that goes outside of the parameters of policy or power or delegated authority in terms of what somebody can do. But when we continue to experience delay after delay after delay, when we come to meetings and individuals ask us for a third time, for a fourth time, why are we here? And we've explained that the first time. These are things that most oftentimes never elevate to the level of the chair and the board. This is everyday business that happens. I believe I could call the chair. I believe I could call one of the commissioners, but you know how much energy it takes to call and say something happened again? That takes a lot of energy. It takes a lot of effort. And all we ask is for individuals who have been hired or placed or selected into positions is when it comes to working with managers of color, as we raise issues, as we raise concerns, let's not only augment, but let's speed up the solution process. We already have the answers. But sometimes it feels as if there are some individuals in positions who do not want change, who love the status quo. And that's not a good feeling. When people who have sat in these chairs, where Elena and I have sat and have testified to this board, to this county, to this state, and said Multnomah County is a regional leader in DEI, my stomach cringes. Because while the outside folks can look at printed material, you have individuals like us on the inside who have a totally different experience, hence 2 Multnomah counties. Doesn't feel good. When I see people in my day-to-day activities in the grocery store and they tell me what they heard about Multnomah County, and I'm not the type of person, as we say in my community, that's going to pour salt on anybody. But I get in my car, chair, and commissioners, and I ride, and I can feel the tears coming because I'm like, why am I not experiencing what these individuals say is happening in Multnomah County? There's an easy solution. It's called accountability, vertically and horizontally. If we discover that somebody has been commissioned, that somebody has been hired to help staff, represented, and for us, non-represented staff, promote, to elevate DEI, and it doesn't happen, we need to be able to have an outlet to an individual that we can talk to so that accountability can be put in place. We don't have a problem saying the word accountability, but we do have an issue when it comes to implementing accountability, because we want to be known as the county that's nice. And to hold somebody accountable unless they do something that's egregious, we don't do, because we don't want to be perceived as mean. It's not being perceived as mean. We're not here calling for anybody's job. We have not said that. We didn't say it in October. We haven't said it this month of April. What we're saying is just hold people accountable. And if individuals don't want to be held accountable, we might have to think of some alternative things to do, because it shouldn't be this hard to show up to work and be your authentic self. I shouldn't have to walk around, Chair, watching my back. And I do. I got a great boss. I got a great leadership team. My colleagues are great. They are special. But in a lot of respects, I walk around this county and I watch my back. You know why? Because there is a fear that somebody will try to cancel me because they don't like what I say. I shouldn't have to walk around like that. Managers of color should not have to experience that. So there's an easy solution. It's called implementation of accountability. If somebody does something that is wrong, they need to know about it. And they need to be accountable to fix it. Not give the chair lip service, not to give the Board of Commissioners lip service. It bothers me when individuals come up here with data and statistics, and I'm not criticizing, I'm just telling how it feels. And we walk away after we hear data, and then we pat ourselves on the back. That bothers me. The data for managers of color will never be significant simply because it's not enough of us in Multnomah County to have any significant type of data. But those of us that are here, our stories matter, our voices matter, our being matters. I'll say this and turn it back to you, Chair. I'm very confident, Chair, that you, Board of Commissioners, Serena, Travis, Joy, I'm very confident that DEI is a priority for you all. I'm very confident about that. What I'm not confident about is throughout this county that it's a priority for everybody. And that's problematic because, Chair, if you're leading with race, if you are prioritizing DEI, but some folks who work for you aren't, and they're in leadership positions where they have delegated authority over other individuals, that is problematic. The average manager in a department will never email you or call any of you to say, I have a problem. They suffer in silence. This is why we're here today. I'm not here for me. I'm here for all of the managers of color who are here in this room. I'm here for our allies that's in the room. And I'm here for all of the managers of color who are even fearful to show up today in the virtual setting. So again, I hear what individuals are saying, and I appreciate it. But when we leave here today, we want to set up some time for interaction, continued dialogue, engagement around two words: accountability and implementation. Thank you so much, Chair. I yield back.
Thank you. Thank you, Dr. Richard. Thank you, Elena. And thank you, Kelly and Rebecca, for sharing this. And I do want to also send my appreciation to people who shared their stories. It's very hard when you hear so many people are doing so anonymously for fear of retaliation, right? That speaks to what people are experiencing, and it definitely doesn't speak to the culture that we want to have and the experience we want people to have. I appreciate the direct focus on accountability and on sustained implementation, right? That's something that is not just about the people who are sitting in these seats or any seats, but about the way that our organization is set up, the processes that we have in place, the structure that we have that really is about holding people accountable and having opportunities for people to share their experiences. Exit interviews are all well and good, but if we are having a conversation when somebody is exiting Multnomah County, we are having the wrong conversation. And there is a lot of work to that. There's a lot of work that will be happening. There's, we are going to be taking on the work of taking the workforce equity strategic plan, the recommendations, the conversations that have been happening around inclusively leading with race at the county, so people do feel safety, trust, and belonging and respect in their jobs, and institutionalizing those. And so I look forward to the ongoing conversation that we'll have, the opportunities in the next weeks and months and years to do that work. And I want you to know that this is important. Your voices are important. Your voices are valuable, but almost more, your work is critical to our success at serving our public at Multnomah County, and incorporating those things so that people feel that they can be here, so that the work can happen, and feel that the words that we say are actually turning into experiences, that's the critical work that we have in front of us, and that's what's so important. So thank you, everyone. There will be definitely more to come, and we will continue to have this conversation. And the last thing I will say is, we never should be afraid to be having this conversation in public. This is important. This is how you shed light on what needs to be brought out of the darkness. And this is work that we want to be doing. It's work we have to be doing. And it is work that that we welcome and that I welcome. And again, and doing it in a way that is about making sure that people are aware of what's happening, so people don't feel that they are alone and they don't feel that they are talking to no one who is listening. That is not what we're about. This is about having this conversation openly, doing the work that needs to be done, and engaging in that hard work and those conversations together, and then changing this institution. And that's what it's all about. So appreciate everyone today. That is our final item for this board briefing. We will be back here on Thursday for our regularly scheduled board meeting. With that, we are adjourned.